Cases have been growing rapidly for the past few weeks, also breaking pandemic records at times. You can see those peaks on this graph right here from the CDC. But as 10 Tampa Bay's Angelina Salcido explains, those peaks are only expected to climb higher in the coming weeks.
Doctors say it's inevitable.
This thing has just been going up like a rocket out of Cape Canaveral.
COVID-19 cases in Florida are dramatically on the rise.
This is pretty much what I expected to see.
USF Public Health's Dr. Unnasch watching the forecast models for the virus closely. He says the estimated peak is on February 2nd. The state will see nearly 110,000 cases daily.
When you hear that number and you see it, do you believe that?
Oh, absolutely. I'm actually surprised that the number is so low, because right now we're averaging about 68,000 cases a day here in Florida. So 100,000 is not even a single doubling from that point in time.
So case numbers will likely be higher and that peak will likely come sooner. Dr. Unnasch says two things are really driving Florida's COVID-19 surge. The fact that the Omicron variant can infect those that are vaccinated, and anyone who gets it has the power to infect 10 people instead of the 5 we were seeing with the Delta variant.
You can see how it just really can explode, because it's at a level of infectiousness that's somewhere now better than chickenpox, probably among the most infectious viruses we've ever seen.
But like their sharp increase, doctors expect cases will downslide.
By Valentine's Day, we're going to be at the back end of this thing.
In the meantime, tens of thousands will get sick over the next few weeks, and hospitalizations will rise.
Hang in there, wear the mask. You know, do what you can to try and keep it from transmitting to other people or to yourself.
Health experts say it may be time to upgrade your mask, too. Here's a sharper insight into why. Researchers at Bangladesh, Stanford, and Yale University found that the infiltration efficiency in surgical masks was about 95%, and the cloth mask was 37%. And Dr. Unnasch says the protection only gets better with an N95 or KN95 mask.
The N95 and KN95 masks that are now readily available are still really, really effective at trapping those aerosol particles that this virus uses to move itself around. Well, I would really recommend people, when they're out again in indoor settings and when they're, around a whole lot of people in a position where they can get exposed to the virus, to wear the N95 or the KN95 masks. As I said before, I don't really care how infectious a virus is or how bad it is. If it never gets in your nose in the first place, it's never going to do you any harm.